As I said at the beginning of this lecture, ischemic heart disease is a consequence of inadequate coronary perfusion or blood supply or oxygen and nutritional supply in relation or in comparison with the myocardial demands. The most common cause is the presence of a fixed, pre-existing or permanent atherosclerotic occlusion of the coronary artery. So the coronary artery is occluded by certain percent of the lumen permanently by the presence of the atherosclerotic plaque, and also the presence of a new superimposed thrombosis and or vasospasm resulting in more narrowing of the vascular lumen. وهون بيجي سؤال مهم، وهو كم نسبة الانسداد in the coronary artery lumen اللي بعدها ببلش مريض الاسكيميك heart disease يحس بالأعراض. This is what we call critical stenosis. نسبة الانسداد التي يبدأ بعدها المريض بالإحساس بالأعراض هي أكثر من 70% of the coronary artery lumen. So the critical stenosis is when the lesion occludes more than 70% of the vascular lumen. شو بيصير عند المريض؟ This will cause symptoms with increased demands. إذا ببلش المريض يحس بالأعراض. معنى ذلك إنه أي ليجن عامل fixed obstruction أقل من 70% المريض رح يكون asymptomatic حتى لو عم بيلعب رياضة أو حتى لو كان هذا المريض عم بيطلع درج. So the fixed obstructions that occlude less than 70% of the coronary vessel lumen typically are asymptomatic even with exertion. طيب متى بصير عند المريض stable angina ومتى بصير عند المريض unstable angina؟ Stable angina, which is the chest pain that happens after certain level of exertion, happens usually when there is an occlusion of more than 70% of the vessel lumen at certain level of exertion. Unstable angina, which is defined as the chest pain that happens with minimal exertion or at rest, this happens usually when there is a fixed stenosis occluding more than or equal 90% of the vascular lumen. As you can appreciate in this figure, this is a patent coronary artery. There is no fixed occlusion, and as you can see the layers from the innermost layer, it's the intima, then the middle layer, which is the media, and then the outermost layer, which is the adventitia. In this figure, the coronary artery is involved by an occluding plaque of less than 70% of the vascular lumen, so the patient is asymptomatic. Here, the coronary artery lumen is involved by an atherosclerotic plaque occupying more than 70% of the vascular lumen. This can result in chest pain after certain level of exertion, which we call stable angina. Atherosclerotic plaques, as I said in the previous lecture, are prone to ulceration, erosion, and maybe rupture. So sometimes due to the turbulent flow over the atherosclerotic plaque, the surface becomes eroded, and this will expose the highly thrombogenic subendothelial tissue, resulting in thrombus formation and platelets aggregation. This will add more into the narrowing of the vascular lumen. If 90% or more of the vascular lumen is occluded by the newly formed thrombus and the fixed atherosclerotic plaque, then the patient usually presents with chest pain with minimal exertion or at rest, which we call unstable angina. However, if the thrombus results in complete occlusion of the vascular lumen, meaning 100% occlusion of one of the coronary arteries, then this will result in myocardial infarction.